I want to tell you something that might sound strange at first, but stick with me because this is going to change how you think about your mind and maybe even your entire approach to managing stress. You know that feeling when the sun goes down and suddenly everything that you managed to keep at bay during the day comes rushing back. When you lie in bed and your brain decides that now, right now, when you desperately need rest, is the perfect time to replay every awkward conversation, every mistake, every worry about tomorrow. You're not imagining it, and you're definitely not alone. What I'm about to share with you is backed by neuroscience, evolutionary biology, and years of clinical practice. And it's going to explain why your anxiety skyrockets at night and what you can actually do about it. Let me start by painting a picture that I see all the time in my practice. Someone comes to me and they say they're functional during the day. They go to work, they interact with people, they get things done. Sure, they feel anxious, but they manage. They keep themselves busy. They focus on tasks. They push through. But then night comes and it's like someone flipped a switch. Suddenly, the anxiety that was manageable becomes overwhelming. They lie in bed and their mind starts racing. Bills they need to pay. That text message they sent that might have come across wrong. The presentation they have next week. The fight they had with their partner 3 years ago. Everything floods in at once and sleep becomes impossible. They toss and turn until 3 in the morning, sometimes jumping into calls with friends just to not feel alone, scrolling through their phone, doing anything to escape the noise in their head. And the whole time, they're wondering why this happens. Why can they handle things during the day but fall apart at night? Here's what's fascinating and honestly a little terrifying. The reason your anxiety gets worse at night isn't just in your head. It's not a personal failing or a character flaw. It's actually built into how your brain and body work. We evolved this way for very specific reasons, and understanding these reasons is the first step to doing something about it. Here's the really scary part, the part that most people don't realize. The very strategies you're using to cope with anxiety during the day, the distraction, the keeping busy, the pushing thoughts aside, these strategies are actually making your nighttime anxiety worse. You think you're managing, but you're actually setting yourself up for a much harder time. When you try to sleep, you're building a dam during the day, and at night, when you finally stop and lie down, dam breaks and everything comes flooding through. Let me explain how this works, starting with the biological mechanisms. See you smiling, because once you understand what's happening in your brain and body, everything else starts to make sense. First, we need to talk about something called circadian rhythms. Your body doesn't function the same way at every hour of the day. You probably know this intuitively. You feel more alert in the morning. You might have an afternoon slump. You get tired at night. But what you might not know is that this isn't just about feeling tired or awake. There are actual hormones and neurotransmitters that fluctuate throughout the day. One of the most important ones for understanding anxiety is cortisol. Cortisol is often called the stress hormone, and for good reason. It's what makes you feel awake and alert. It increases your heart rate, raises your blood pressure, boosts your blood sugar, activates your immune system. It basically revs you up and gets you ready for action. In a healthy person with normal cortisol levels, here's what happens throughout the day. At midnight, your cortisol is at its lowest point. Then, as morning approaches, it starts to rise. Time you wake up, usually around 7 in the morning, it peaks. This is why you hopefully feel most alert and energized in the morning. Then throughout the day, it gradually decreases. By 6 in the evening, it's low again, preparing your body for sleep. This rise and fall, this curve of cortisol throughout the day is crucial for healthy functioning. But here's the problem. People with anxiety disorders don't have this nice, healthy cortisol curve. Instead, they have what's called a flattened cortisol curve. Instead of having high peaks in the morning and low valleys at night, their cortisol stays more constant throughout the day. It doesn't rise as high in the morning, but more importantly for our discussion, it doesn't fall as low at night. Someone with anxiety tries to go to sleep, they still have elevated levels of this stress hormone coursing through their body. It's literally harder for them to calm down because their body chemistry is working against them. Imagine trying to fall asleep after drinking several cups of coffee. That's essentially what's happening when your cortisol doesn't drop the way it should. Now, you might be thinking, okay, that's biological, that's something I can't control, but here's where it gets interesting. The cortisol curve isn't completely fixed. It's influenced by psychological stress and how we handle that stress. We deal with anxiety, and stress throughout the day actually affects our cortisol levels. If we're constantly stressed, constantly anxious, constantly in fight or flight mode, our cortisol stays elevated. If we find ways to genuinely process and reduce stress, our cortisol can normalize. So while there's definitely a biological component to anxiety disorders, handle our anxiety directly impacts our biology at night. Keep this in mind because we're going to come back to it. Now let's talk about the second mechanism, and this one is really fascinating. To understand it, we need to look at how the brain works during sleep, particularly what happens with different brain regions. I want you to think about two specific parts of your brain. The first is your frontal lobe, the part right behind your forehead. This is your executive control center. It's responsible for willpower, restraint, discipline, focus, and importantly for our discussion, emotional regulation. When you feel an emotion but decide not to act on it, that's your frontal lobe at work. When you feel anxious but push through and do what you need to do anyway, your frontal lobe suppressing the anxiety and keeping you functional. The second part we need to talk about is the amygdala. This is a small almond-shaped structure deep in your brain, and it's your fear and anxiety center. When you feel afraid or anxious, your amygdala is lighting up. It's also your survival center. Think about it this way. If you're walking through the woods and you see a bear, fear is what keeps you alive. Fear is what makes you run or freeze or do whatever you need to do to survive. The amygdala is there to detect threats and generate the emotional response that keeps you safe. Now, here's where things get really interesting. When you go to bed at night, your amygdala activity naturally increases. This isn't a bug, it's a feature. Your brain is designed to have a more active amygdala at night. Why would this be? Why would we evolve to feel more anxious and afraid when we're trying to sleep? The answer has to do with dreaming and emotional processing. When do you experience the most intense emotions during a 24-hour period? Not when you're awake going about your day. It's when you're asleep and dreaming. Think about nightmares. A nightmare is terrifying precisely because it generates intense fear. Where does that fear come from? Your amygdala. When you have a nightmare, your amygdala is firing intensely. There's good evidence that one of the main reasons we dream is to process emotions. During the day, we experience all kinds of emotional events. We deal with consciously, but many we just move past without really processing. Dreams give us a chance to work through these emotions in a safe environment. In order to process emotions, though, the emotional centers of the brain need to be active. They can't be in read-only mode. They need to be in edit mode. We need to be able to access and work through our feelings. This is why people who study dreams, going all the way back to Freud and Jung, discovered that the dreams we have correlate with the emotions we experience. As a clinician, I've seen this over and over. When I work with a patient who has a lot of nightmares, as we work through those nightmares and what they represent, their emotional state gets better during the day. And when we work on their anxiety during the day, their nightmares decrease at night. Two are intimately connected. So we've established that the amygdala naturally becomes more active at night. That's reason number one why anxiety increases. But it gets worse. Remember the frontal lobe, that part of your brain that controls emotions and suppresses anxiety. During the day, when you feel anxious, your frontal lobe can step in and say, we don't have time for this right now. We have work to do. We need to focus. It actively suppresses the amygdala and keeps your anxiety in check. But here's the problem. The frontal lobe can't be active 24 hours a day. It gets drained. If you've spent all day suppressing emotions, exerting willpower, staying disciplined and focused, by the end of the day, you feel exhausted. That exhaustion is real. It's not just in your imagination. Your frontal lobe has used up its resources. Willpower is actually a diminishing resource. You start the day with a certain amount of it, and as you use it, it depletes. This is why it's easier to stick to your diet in the morning, but harder to resist the cookies in the evening. This is why you can focus better early in the day, but struggle to concentrate at night. Your frontal lobe needs rest, and it gets that rest when you sleep. So as you go to bed, your frontal lobe shuts down. It decreases in activity. Again, this is a feature, not a bug. You need your frontal lobe to recover so it can function well the next day. But what happens when your frontal lobe shuts down? Your ability to suppress anxiety decreases. The part of your brain that says, calm down, it's going to be okay, we can handle this, that part is going offline. Do you see what's happening here? At night, the part of your brain that generates anxiety and fear turns on more, and the part of your brain that suppresses anxiety turns off. It's a double whammy. This is why nighttime anxiety is so much worse. You have more anxiety being generated and less ability to control it. This is not a personal failing. This is not you being weak or unable to cope. This is basic neuroscience. Your brain is designed this way. But wait, there's more. And this is where most people unknowingly make things much worse for themselves. Let's talk about distraction and why distracting yourself from anxiety during the day is one of the worst things you can do for your sleep. During the day, when you feel anxious, what do? Most people distract themselves. They keep busy. They focus on work. They scroll through their phone. They watch videos. They talk to friends. They do anything to push the anxiety away and not think about it. And in the moment, this works. The anxiety decreases. You feel better. You can function. You conclude that distraction is an effective coping strategy. But here's the problem. What are you actually teaching your brain? Every time you feel anxious and immediately distract yourself with external stimuli, you're conditioning your brain to rely on external stimuli to regulate anxiety. You're not learning to regulate anxiety internally. You're not developing the capacity to sit with uncomfortable feelings and let them pass. You're not building up your tolerance for anxiety. Instead, you're training your brain that the way to deal with anxiety is to use your eyes to look at something engaging, to use your ears to listen to something distracting, to use your hands to scroll or type or do something active. You're creating a dependency on sensory input for emotional regulation. Now, imagine what happens when you go to bed. You lie down, you close your eyes, you try to sleep. What's the defining feature of trying to sleep? Sensory deprivation. The external stimuli goes away. That's the whole point. You're in a dark, quiet room, not doing anything, just lying there. Your brain has been conditioned all day to use external stimuli to manage anxiety. So when the external stimuli disappears, what happens to all that anxiety you've been suppressing? It comes roaring back. And it often comes back even harder than it was during the day because it's been building up. You've been pushing it down all day, distracting yourself, not dealing with it, and it's been accumulating. So now you're lying in bed with no distractions available, and all that pent up anxiety floods your system. Think of it like this. During the day, you're building a dam to hold back water. Every time you distract yourself, you're adding another stone to the dam. The water keeps rising behind the dam. You don't see it because the dam is holding it back. Then night comes, you lie down, and suddenly the dam breaks. All that water, all that anxiety comes pouring through at once. You're not just dealing with the anxiety of the present moment, you're dealing with accumulated anxiety from the entire day. This is why some people describe their nighttime anxiety as overwhelming, as a flood. That's exactly what it is. And here's something else that happens at night that makes anxiety worse. They part of your brain called the default mode network. This is the network that activates when you're not focused on external tasks, when your mind is free to wander. It's responsible for self-referential processing, which is a fancy way of saying thinking about yourself. What am I doing with my life? Did I say the right thing earlier? What does that person think of me? Am I making the right decisions? The default mode network is what generates these kinds of thoughts. During the day, when you're busy and focused on tasks, default mode network is relatively quiet. But when you lie down at night and stop engaging with external tasks, the default mode network kicks into high gear. And what does an anxious person's default mode network think about? Worries, regrets, fears, worst case scenarios, all the things that fuel anxiety. Did I pay that bill? What if my partner is mad at me? What if I fail at that project? Why did I embarrass myself like that 5 years ago? The default mode network activates. You start thinking about yourself and your life. And if you're prone to anxiety, these thoughts quickly spiral into worry and fear. There's research showing that people with anxiety and depression both have overactive default mode networks. This contributes significantly to insomnia. When both conditions are present together, the problem is even worse because The hyperactive default mode network feeds into both the anxious thoughts and the depressive rumination. You lie in bed thinking about yourself, and those thoughts are negative, anxious, and self-critical. It becomes a perfect storm for sleeplessness. Now let's talk about melatonin, because this adds another layer to the picture. Melatonin is often thought of as just a sleep hormone, something that makes you drowsy. But it does much more than that. Melatonin actually affects brain chemistry in important ways. Specifically, it increases something called GABAergic tone. GABA is a neurotransmitter that basically calms things down. It's a suppressing neurotransmitter. When GABA levels increase, neurons are more likely to shut off, to stop firing. This is how alcohol and medications like Xanax work, by the way. They increase GABA transmission, which is why they have calming, sedating effects. Melatonin does something similar. As melatonin rises at night, increases GABA, which helps shut things down and prepare your brain for sleep. Now remember our amygdala problem. The amygdala is becoming more active at night. We need something to balance that out to keep it from getting out of control. During the day, the frontal lobe suppresses the amygdala. At night, when the frontal lobe shuts down, melatonin and GABA take over that suppressing role. They provide the inhibition needed to keep the amygdala in check. But here's the problem. People who struggle with anxiety often have disrupted melatonin production. Their melatonin rhythms are off. They don't produce enough melatonin at the right times. Now we have a situation where the amygdala is becoming hyperactive at night as it normally does. The frontal lobe is shutting down as it normally does, but melatonin isn't stepping in to provide the necessary inhibition. There's nothing to balance out the increased amygdala activity. The result is overwhelming anxiety with no natural brake system to slow it down. There's another reason the amygdala becomes more sensitive at night, and this one is really interesting. Think about what sleep means from an evolutionary perspective. When you sleep, you're vulnerable. You're unconscious, unaware of your surroundings, unable to defend yourself. This is incredibly dangerous from a survival standpoint. So what does the brain do? It increases threat detection. Your amygdala becomes hypersensitive so that even while you're asleep, your brain is monitoring for danger. This is why you can wake up instantly if you hear a strange noise. Your heightened threat detection system has picked up on something potentially dangerous. To compensate for this increased vulnerability and heightened threat perception, we try to create safe sleeping environments. We lock our doors, alarms, close our windows, sleep under blankets in a secure room. We want to be in a safe place precisely because we know that our threat detection is ramping up. Think about trying to sleep in an airport. It's incredibly difficult, right? You feel paranoid. You pile all your stuff around you. You put your legs over your bags. You keep one eye half open. Why? Because your amygdala is screaming that this is not a safe place to sleep. Your threat detection is heightened, and you don't have the safety cues that normally allow you to relax and actually fall asleep. Let me summarize what we've covered so far, because I know this is a lot of information. Your anxiety gets worse at night for multiple biological reasons. Your cortisol curve is likely flattened, meaning you have more stress hormone in your system at night than you should. Your amygdala naturally becomes more active at night to facilitate emotional processing through dreams and to maintain threat detection while you sleep. frontal lobe shuts down at night to recover, removing the main brake on your amygdala during the day. Your melatonin production might be disrupted, meaning you lack the chemical suppression needed to balance the increased amygdala activity. Default mode network kicks into gear when you're not distracted, leading to self-referential thoughts that often spiral into anxiety. And on top of all this, if you've been distracting yourself from anxiety all day, you've conditioned your brain to need external stimuli to regulate emotions. And sleep, by definition, removes all external stimuli, leaving you defenseless against the accumulated anxiety of the day. Are you starting to see why nighttime anxiety is such a common and serious problem? It's not one thing going wrong, it's multiple systems all conspiring to make anxiety worse at night. And most people have no idea this is happening. They just know they feel awful and can't sleep, and they beat themselves up for it, thinking they're not trying hard enough or that something is fundamentally wrong with them. But now you know better. You know, this is biology. While that might sound discouraging, like it's out of your control, it's actually empowering, because once you understand the mechanisms, you can start to work with them instead of against them. So how do we fix this? How do we deal with nighttime anxiety in a way that actually works? I'm going to give you several strategies. I want you to understand that these aren't quick fixes. This is about retraining your brain and changing your relationship with anxiety. It takes time and practice, but it works. Let's start with the most counterintuitive and probably most important strategy. You need to stop distracting yourself from anxiety, at least not exclusively. I know what you're thinking. If I don't distract myself, I won't be able to function. I'll be completely overwhelmed. I have patients tell me this all the time. But here's the thing, that's not actually true. What happens when you stop distracting yourself from anxiety is that you start triggering homeostatic mechanisms. What does that mean? Homeostasis is your body's ability to maintain balance and return to baseline. Every emotion you experience, whether it's joy, sadness, anger, or anxiety, has a natural lifespan. Emotions arise, peak, and then fade. They don't last forever. Doesn't last forever, no matter how good things are. And anxiety doesn't last forever either, even though it feels like it will. When you feel anxiety and you don't distract yourself from it, when you just sit with it and let it be there, something remarkable happens. It naturally starts to decrease. Your body has built-in mechanisms to regulate emotions and bring you back to baseline. Now, I know people with anxiety disorders are going to push back on this. They're going to say, that's not true for me. My anxiety doesn't go away on its own. It just gets worse and worse until I do something about it. But let me be precise here. In an anxiety disorder, two things are different. First, the duration and intensity of anxiety are both higher than normal. Your anxiety lasts longer and feels more intense. That's the nature of the disorder. Second, and this is crucial, anxiety does actually expire. People with anxiety disorders often create new anxiety through a process called rumination before the old anxiety has a chance to fade. Let me explain how this works. When you have an anxious thought, there's a pattern to how the anxiety unfolds. The thought arises, anxiety increases as you focus on it, reaches a peak, and then would naturally decrease if left alone. But what happens with rumination? Right in the middle of that cycle, you start generating additional anxious thoughts. What if this happens? And then What if that happens? And what about this other terrible thing? Each new thought generates its own anxiety cycle. You never get to experience the natural decrease of any single anxiety because you're constantly creating new ones. It's not that homeostasis isn't working, it's that you're not giving it a chance to work. You're creating a spiral by constantly feeding new fuel to the fire. This is why stopping rumination is so important. That's a whole topic in itself that I won't fully dive into here. But the key point is this: if you can sit with anxiety without distracting from it and without ruminating on it, it will decrease on its own. Your body wants to return to baseline. It's designed to. But you have to give it the opportunity. When you immediately distract yourself every time you feel anxious, you never learn that anxiety can and will pass on its own. You never build up your tolerance for uncomfortable feelings. You never develop the internal capacity to regulate emotions. And then at night, distractions aren't available. You have no other tools to use. So what does it look like to sit with anxiety instead of distracting from it? This is where practices like meditation, exercise, and walking come in. These aren't just generic wellness advice. They're specific tools for learning to be with anxiety without trying to make it go away. When you go for a walk, especially if you leave your phone behind and just walk, you're giving yourself time to feel whatever you're feeling. The anxiety might be there. That's okay. Let it flow. Let the thoughts come up. Don't try to push them away, but also don't chase them down rabbit holes. Acknowledge them and keep walking. Walking is particularly good because the physical movement helps discharge some of the physical tension that comes with anxiety. You're not distracting yourself with anything engaging. You're just walking and being with yourself. Meditation works similarly. You sit quietly, and all the thoughts and feelings you've been pushing away all day start to come up. This can be uncomfortable, especially at first. But that's the point. You're practicing being with discomfort without needing to escape it. You're learning that you can feel anxiety and be okay. You're not in danger. The feeling is unpleasant, but it's just a feeling. It can't actually hurt you. And as you practice sitting with it, something shifts. The anxiety stops feeling so threatening. You develop confidence that you can handle it. And crucially, you're training your brain in a different way to regulate anxiety. Instead of reaching for external stimuli, you're using internal resources like breath awareness, body awareness, and acceptance. Speaking of breath, let's talk about breathing techniques because this is huge for anxiety regulation. Your breathing directly affects your nervous system. When you're anxious, you tend to breathe quickly and shallowly. This triggers your sympathetic nervous system, your fight or flight response, which creates more anxiety. It becomes a vicious cycle. The opposite is also true. When you breathe slowly and deeply, especially with long exhalations, you activate your parasympathetic nervous system, your rest and digest response. This calms you down. It's a direct physiological pathway to reducing anxiety. There are specific breathing practices that are particularly effective for anxiety. One that I often teach patients is to focus on making your exhale longer than your inhale. You might breathe in for a count of 4 and out for a count of 6 or 8. The long exhale is key because it's what activates the parasympathetic nervous system. Another technique is to breathe slowly in general reducing the number of breaths per minute. Normal breathing is maybe 12 to 15 breaths per minute. If you can slow down to 6 to 8 breaths per minute with long exhales, you'll notice a significant decrease in anxiety. There are also traditional practices from yoga that can be very effective. One is a technique where you curl your tongue into a tube shape and breathe through it. Automatically slows down both inhalation and exhalation, which calms the nervous system. The details of specific techniques aren't as important as understanding the principle. Breathing with long exhales activates your calming response and directly counteracts the physiological arousal of anxiety. This is something you can do during the day when you feel anxious, and it's something you can do at night when you're lying in bed and anxiety is keeping you awake. Key difference between breathing techniques and distraction is that breathing is an internal regulation strategy. You're not looking for something external to make the anxiety go away. You're using your own body's mechanisms to calm yourself down. You're building internal capacity for emotional regulation. This is exactly what you need at night when external distractions aren't available or helpful. Now let's talk about some other practical strategies. First, if you're dealing with significant nighttime anxiety, you should talk to a doctor or mental health professional. There are medical conditions that can contribute to anxiety and insomnia, circadian rhythm disorders, and there are treatments available. Melatonin supplements might be helpful for some people, especially if your natural melatonin production is disrupted. This is something you should discuss with a doctor because melatonin isn't right for everyone and the dosage matters. Second, increase what I call pro-sleep signals during the day. What does this mean? Your ability to fall asleep at night depends significantly on how you spend your day. Your brain and body need to feel that the day is complete, you've done enough, that it's okay to shut down now. If you spend all day procrastinating and not accomplishing what you intended, your brain is going to resist sleep because there's still so much left undone. It's going to think the day can't be over yet. We have twice as much to do tomorrow. It will keep you awake with anxiety about all the unfinished tasks. Way to improve your sleep is to actually be productive during the day. Complete tasks. Accomplish things. Give your brain evidence that you've done enough and earned your rest. This doesn't mean you have to work yourself to exhaustion. It means being intentional about your day, doing what you set out to do, and ending the day with a sense of completion. Exercise is another powerful pro-sleep signal. When you exercise, you're sending a message to your body that you've exerted energy, you've worked physically, that you've done something demanding. This naturally promotes sleep. A heavy meal, particularly one rich in carbohydrates, can also promote sleep because of the insulin response and the resources required for digestion. The specific strategies matter less than the overall principle. Your body makes decisions about sleep based on inputs throughout the day. If those inputs signal that you've had a full, complete day with appropriate exertion and completion of tasks, sleep comes more easily. If those inputs signal that the day was incomplete, unfulfilling, or insufficient, your brain resists sleep. Pay attention to this. Now, here's something that most people don't understand, and this is absolutely critical. You have a sleep window each day, a specific period of time when it's relatively easy to fall asleep. If you miss that window, falling asleep becomes much harder. Most people assume that the more tired they get, the easier it is to fall asleep. That seems logical, right? But it's actually wrong. The relationship between tiredness and ease of falling asleep is not linear. There's a sweet spot where you're tired enough that your body wants to sleep, not so tired that you've passed the point where sleep comes naturally. Let me explain what I mean. To fall asleep, your frontal lobe actually needs to have some energy left. This sounds paradoxical, but think about what falling asleep requires. You have to shut down all the active parts of your mind. You have to stop thinking, stop planning, stop worrying. You have to resist the urge to check your phone one more time, to get up and do one more thing, to turn on the TV. You have to be okay with just lying there, being bored, waiting for sleep to come. All of that requires self-control and willpower. Self-control and willpower come from your frontal lobe. There's a window of time each evening when your frontal lobe still has enough juice to exert the control needed to fall asleep. You're also tired enough that your body wants to rest. This is your sleep window. If you try to sleep during this window, it's relatively easy. Your frontal lobe can suppress the parts of your brain that want to stay active. It can help you resist distractions and settle into sleep. But if you stay up past this window, your frontal lobe becomes too depleted. It no longer has the energy to exert control. And then what happens? You enter a state of overtiredness where you're exhausted, but you can't fall asleep. You can't control your thoughts. You can't resist the urge to get up and do things. You become restless and agitated. You've moved from the phase where sleep comes naturally to the phase where the only way you'll sleep is by essentially passing out from extreme exhaustion. Do you understand the difference between falling asleep and passing out? Falling asleep is a controlled process. Your frontal lobe is guiding you into sleep, shutting things down in an orderly way. Passing out is what happens when you're so exhausted that your brain can no longer function and just shuts off. There's always a gap between when you could have fallen asleep and when you're tired enough to pass out. During that gap, you're too tired to sleep normally, but not tired enough to pass out. This is where a lot of people with insomnia get stuck. I learned about this when I was putting my kids to bed. There's a window of time when they're ready for sleep. If I start the bedtime routine during that window, put them in pajamas, read a story, tuck them in, they go to sleep relatively easily. They might ask for a glass of water or one more hug, but they settle down. But if I miss that window, if it's past their bedtime and they're overtired, chaos ensues. Suddenly, they need to go to the bathroom. They need a different stuffed animal. They have to tell me something important. They can't possibly close their eyes. They're bouncing off the walls despite being exhausted. Their frontal lobe is shot. They have no self-control left. I end up having to work twice as hard to get them to bed, and there's often crying and frustration on both sides. We missed their sleep window, and now sleep is exponentially harder. The same thing happens to adults. We just don't usually have someone observing and pointing it out. You stay up too late working on something or watching a show, and you miss your sleep window. By the time you actually get into bed, you're overtired. Your frontal lobe is depleted. You can't control your thoughts. Your mind races. You get up to check things. You feel restless. You think there must be something wrong with you, but really, you just missed your window. And when you finally do fall asleep from sheer exhaustion, it's not a restful sleep. You're more fatigued than you would have been if you'd slept during your natural window, and a full night of sleep doesn't fully restore you because you accumulated bonus fatigue by staying up too late. How do you know when your sleep window is? Generally, it starts about 14 to 16 hours after you wake up. For most people, that's somewhere between 8 and 10 at night. But the best way to identify it is to pay attention to your body. You'll start to feel tired. Your eyes might feel heavy. You might yawn. This is the signal. This is when you should start your bedtime routine, even if you don't feel ready to sleep yet. The key is to go to sleep before you feel completely exhausted. That's actually when it's easiest to fall asleep. If you wait until you're absolutely wiped out, you've probably missed your window. This is hard for a lot of people because we're trained to stay up as late as possible, squeeze every last bit of productivity or entertainment out of the day. We don't want to go to bed early because it feels like we're wasting time. But I'm telling you, going to bed during your sleep window is one of the most important things you can do for your anxiety and overall mental health. Is when your frontal lobe recovers. It's when your cortisol resets. It's when your melatonin does its work. If you consistently get good sleep by honoring your sleep window, your anxiety during the day will improve. Your ability to handle stress will improve. Everything gets better. Another factor that helps with sleep is light exposure. Watching the sunset, spending time outside in the evening, and then being in dim light after dark all help regulate your circadian rhythm. Your brain uses light cues to know what time of day it is and when it should be producing melatonin. If you're in bright artificial light all evening, your brain thinks it's still daytime and delays melatonin production. Then you lie down to sleep, but your brain isn't ready because it hasn't received the signals that night has arrived. Exposure to natural light patterns, especially in the evening and early morning, helps keep your circadian rhythm on track. Now I want to talk about something that comes up a lot with patients. They tell me, I understand what you're saying about not distracting from anxiety, but I literally cannot function if I don't distract myself. If I just sit with my anxiety, I'll be completely overwhelmed and I won't be able to work or take care of my responsibilities. This is a valid concern, and I want to address it directly. The goal is not to never distract yourself from anxiety. The goal is to not exclusively rely on distraction as your only coping mechanism. There's a difference. What I'm suggesting is that you carve out some time each day, maybe 20 or 30 minutes, where you specifically allow yourself to feel anxious without distracting from it. You go for a walk, you sit quietly, you do some breathing exercises, whatever works for you, and you let the anxiety be there. You practice sitting with it. You let some of it process and discharge naturally. Then, for the rest of the day, if you need to distract yourself to be functional, okay, that's fine, continue. But you've given yourself some time to actually process emotions instead of just suppressing them all day long. You'll likely find over time is that as you build your capacity to sit with anxiety, you need distraction less and less. The anxiety becomes less intense because you're not constantly suppressing it and letting it build up. You develop confidence that you can handle uncomfortable feelings. You're not as afraid of the anxiety itself. And crucially, you're training your brain in multiple ways to regulate emotion, not just through external distraction. You go to bed at night and distractions aren't available. You have other tools to use. This is where working with a therapist or counselor can be really valuable. Cognitive behavioral therapy, or CBT, excellent techniques for managing anxiety. You learn to identify anxious thoughts, examine whether they're realistic, reframe them in more balanced ways. You learn to challenge the catastrophic thinking that fuels anxiety. You do exposure exercises where you gradually face feared situations and learn that the terrible outcomes you imagine don't actually happen. All of this helps you develop a different relationship with anxiety. Instead of seeing it as this overwhelming force that you have to suppress or distract from, you start to see it as uncomfortable but manageable. You learn that you can experience anxiety and still function, still make decisions, still live your life. Another therapeutic approach that can be helpful is something called acceptance and commitment therapy, or ACT. This focuses less on changing your thoughts and more on changing your relationship to your thoughts. Instead of trying to make anxiety go away, you learn to acknowledge it and make room for it while still moving toward your values and goals. You learn that you don't have to wait until anxiety is gone to live your life. You can take action even when you're feeling anxious. This is incredibly empowering and reduces a lot of the secondary anxiety that comes from being anxious about being anxious. Mindfulness practices tie into this as well. Mindfulness is about being present with whatever is happening right now without judgment. When you practice mindfulness, you notice that you're feeling anxious. You notice the thoughts, the physical sensations, urge to escape or distract, and you just observe it all without trying to change it. You might say to yourself, I'm noticing that I'm feeling anxious right now. My chest feels tight. My mind is spinning. And that's okay. This is just what's happening right now. This kind of observation creates a little bit of distance between you and the anxiety. You're not completely identified with it. You're the one noticing it, which means you're more than just your anxiety. All of these approaches, CBT, ACT, mindfulness, breathing techniques, they give you ways to work with anxiety internally instead of just trying to escape it externally. And that's what makes them effective for nighttime anxiety. Because at night, when you're lying in bed trying to sleep, you can't escape. You can't run away. You can't distract yourself, or at least you shouldn't if you want to actually sleep. So you need internal tools. You need to be able to regulate your nervous system, challenge catastrophic thoughts, accept uncomfortable feelings, trust that they will pass. These are skills you can develop with practice. Let me address one more thing that comes up frequently: rumination. Rumination is when you get stuck in a loop of repetitive negative thinking. You go over the same worries or regrets again and again. Why did I say that? What if this happens? I should have done that differently. The thoughts just cycle endlessly. Rumination is one of the main reasons why anxiety doesn't naturally decrease for some people. As I mentioned earlier, each ruminating thought generates its own anxiety cycle, so you're constantly creating new anxiety before the old anxiety has a chance to fade. Breaking the rumination cycle is crucial for managing anxiety both during the day and at night. There are several strategies that can help. One is thought stopping. When you notice you're ruminating, you consciously interrupt the thought pattern. You might say to yourself, stop. You might visualize a stop sign, or you might snap a rubber band on your wrist. Physical or mental interruption breaks the cycle momentarily. Then you redirect your attention to something else, ideally something engaging that requires focus. This isn't the same as unhealthy distraction because you're not using it to avoid all anxiety. You're specifically using it to break a rumination loop. Another strategy is to schedule worry time. This might sound strange. It can be effective. You set aside a specific time each day, maybe 15 or 20 minutes, where you allow yourself to worry about everything. You write down all your worries, think through worst case scenarios, whatever you need to do. Outside of that designated time, when worries pop up, you tell yourself, not now, I'll think about that during my worry time. This helps contain the rumination instead of letting it take over your whole day and night. Many people find that when they actually sit down during their scheduled worry time, they have less to worry about than they thought. At the act of containing and scheduling, the worry reduces its power. Journaling can also help with rumination. When you write down your worries, you externalize them. They're not just spinning in your head anymore, they're on paper. This can give you a sense of relief and also helps you see patterns. You might realize you worry about the same things over and over, and that can help you recognize rumination when it starts. You might also be able to problem solve more effectively when you see your worries written out. Of them might have actual solutions that you can implement. Others you might recognize as things outside your control that you need to accept rather than worry about. Cognitive diffusion is another helpful technique. This comes from ACT and involves recognizing that thoughts are just thoughts, not facts. When you have the thought, something terrible is going to happen, instead of believing it and getting caught up in anxiety, you notice it as a thought. You might say to yourself, I'm having the thought that something terrible is going to happen. Small shift in language creates distance. The thought is still there, but you're not completely fused with it. You're observing it rather than being consumed by it. This makes it easier to let the thought pass without spiraling into rumination and anxiety. All of these techniques require practice. You're not going to master them overnight. But with consistent effort, they become more natural and effective. And as you get better at managing rumination, you'll notice that your anxiety becomes more manageable overall, including at night. Let me talk about what to do when you're lying in bed and anxiety is keeping you awake, because it's where the rubber meets the road. All the strategies I've discussed are important for addressing the root causes of nighttime anxiety. What do you actually do in the moment when you're tossing and turning at 2 in the morning? First, resist the urge to reach for your phone or turn on the TV. I know that's what you want to do. I know distraction feels like the only way to get relief. But remember what we talked about. Distraction conditions your brain to need external stimuli for emotional regulation. If you distract yourself every time you can't sleep, you're reinforcing the pattern that makes nighttime anxiety worse. You're teaching your brain that anxiety at night requires external intervention. Instead, try the breathing techniques we discussed. So on slow, deep breaths with long exhalations. This will activate your parasympathetic nervous system and help calm your body. It might not make the anxiety disappear immediately, but it will start to bring your arousal level down. As you breathe, notice what's happening in your body. Where do you feel the anxiety? Is it in your chest, your stomach, your throat? Observe it without trying to make it go away. Sometimes anxiety increases when we resist it. When we can make space for it and stop fighting it, it starts to ease. If your mind is racing with thoughts, you can try a few things. One is to mentally note the thoughts as thinking. Each time a thought arises, you just label it. Thinking, when I work with people, and then return your attention to your breath. You're not engaging with the content of the thoughts, you're just noting that thinking is happening. Another approach is to imagine your thought as clouds passing across the sky or leaves floating down a stream. You observe them coming and going without grabbing onto them. This creates distance and reduces the power of the thoughts. If you've been lying in bed for more than 20 or 30 minutes and you're still wide awake and anxious, it might be helpful to get up. Not to distract yourself with your phone, but to do something calm and quiet in dim light. You might sit in a chair and do some breathing exercises or meditation. You might read a boring book. The key is to not stimulate yourself further. You want to stay in a calm, restful state, even though you're not sleeping. After 20 or 30 minutes, go back to bed and try again. Sometimes just removing the pressure of trying to sleep can make it easier to actually fall asleep. Throughout all of this, be kind to yourself. Nighttime anxiety is hard. It's uncomfortable and frustrating and exhausting. You're not weak or broken for experiencing it. You're dealing with a challenging condition that has real biological and psychological components. Give yourself credit for working on it. Small improvements. If you usually lie awake for 3 hours and one night it's only 2 hours, that's progress. If you usually distract yourself with your phone all night and you manage to use breathing techniques for even 10 minutes, instead, that's progress. Change happens gradually, and it's important to acknowledge the steps along the way. I also want to address the role of medication because this comes up a lot. Some people benefit from medication for anxiety and sleep. Anti-anxiety medications, antidepressants, sleep aids, these can all be helpful tools for some people. But they're not magic bullets. They're not right for everyone. Medications work best when combined with the behavioral and psychological strategies I've been discussing. Medication might help reduce your anxiety to a more manageable level, but you still need to learn how to regulate emotions internally. You still need to address the patterns of distraction and rumination. You still need to honor your sleep window and create good sleep conditions. If you're considering medication, talk to a psychiatrist or doctor who can evaluate your specific situation and explain the options. Be honest about your symptoms and how they're affecting your life. And if you do start medication, give it time to work. Most medications for anxiety and depression take several weeks to reach full effectiveness. Don't expect immediate results, and don't stop taking medications suddenly without talking to your doctor, as that can cause withdrawal symptoms and make things worse. Also know that medication isn't the only option, and for many people, the behavioral and psychological approaches I've discussed are sufficient. It depends on the severity of your anxiety, how much it's interfering with your life, and what other factors might be contributing. There's no one size fits all answer. The important thing is to take action and get support rather than just suffering in silence and hoping it gets better on its own. Let me return to the fundamental insight I want you to take from all of this. Nighttime anxiety is not random. It's not a personal failing. It's the result of specific biological mechanisms that are actually designed to protect you, but that can go haywire, especially when combined with modern stressors and ineffective coping strategies. Your cortisol curve is flattened. Your amygdala activates at night. Your frontal lobe shuts down. Your melatonin production is disrupted. Your default mode network kicks into gear. And if you've been distracting yourself all day, you've conditioned your brain to rely on external stimuli for emotional regulation, which sets you up for a crash when those stimuli disappear at night. Understanding these mechanisms is empowering because it means there are specific, actionable things you can do to address the problem. You can work on normalizing your cortisol curve by managing stress better during the day. You can learn to sit with anxiety instead of constantly distracting from it, breaks the cycle of accumulation and conditions your brain for internal regulation. You can use breathing techniques to directly calm your nervous system. You can address rumination so that anxiety naturally expires instead of constantly regenerating. You can honor your sleep window so your frontal lobe has the energy it needs to guide you into sleep. You can create good sleep conditions and maintain healthy circadian rhythms through light exposure and routine. You can work with a therapist to develop better coping strategies. And if needed, you can talk to a doctor about whether medication might be helpful. None of these solutions is instant or effortless. Changing long-standing patterns takes time and consistent effort. The effort is worth it because good sleep is foundational for mental health. When you sleep well, your frontal lobe recovers. Your cortisol resets, your emotional regulation improves, your ability to handle stress increases. Everything gets better. And conversely, when you're not sleeping well, everything is harder. Your anxiety is worse. Your mood is worse. Your concentration is worse. Your physical health suffers. So addressing nighttime anxiety and insomnia isn't just about feeling better at night, improving your entire life. I've seen this transformation in countless patients. Someone comes to me barely functioning, exhausted and anxious all the time, feeling like they're losing their mind. We work on the strategies I've described. We address the daytime anxiety patterns. We build skills for emotional regulation. We fix the sleep issues. And gradually, things shift, improves, which improves daytime functioning, which reduces anxiety, which further improves sleep. It's a positive cycle instead of a negative one. The person starts to feel like themselves again. They have some control over their mind and body. That's possible for you too. One thing I want to emphasize is that about half of your anxiety comes from your body, not your mind. This is something people often don't realize. They think anxiety is all mental, all about thoughts and worries. But there's a huge physiological component. Your nervous system arousal, your cortisol levels, your breathing patterns, your muscle tension, your gut health, your nutrition, all of these physical factors contribute to how anxious you feel. This is actually good news because it means there are physical interventions that can help, things like exercise, breathing techniques, dietary changes, anything that calms your nervous system. Exercise is particularly powerful. When you exercise, you're using up stress hormones like cortisol and adrenaline. You're releasing tension from your muscles. You're improving your cardiovascular health, which affects your nervous system. You're often getting outside and exposed to natural light, which helps regulate your circadian rhythm. And you're giving your brain clear signals that you've exerted energy and done something demanding. Promote sleep at night. You don't need to run marathons. Even a daily walk can make a significant difference. Diet also matters more than people realize. If you're eating a lot of sugar and processed foods, you're putting yourself on a blood sugar roller coaster that can trigger anxiety. If you're drinking a lot of caffeine, especially later in the day, you're directly stimulating your nervous system and making it harder to calm down at night. If you're not eating enough, your body might be in a stress state that produces anxiety. Simple changes like eating regular, balanced meals with adequate protein and healthy fats, reducing caffeine intake, and avoiding heavy meals right before bed can all help reduce anxiety. Your gut health is also connected to anxiety through what's called the gut-brain axis. Bacteria in your gut produce neurotransmitters that affect your mood and anxiety levels. If your gut is unhealthy, it can contribute to anxiety. Eating fermented foods, taking a probiotic, reducing processed foods, eating plenty of fiber can all support gut health and potentially reduce anxiety. This is an emerging area of research, but the connection is real. The point is, don't just think about anxiety as a mental problem that you need to think your way out of. Think about it as a whole body problem that requires a comprehensive approach. Address your thoughts and behaviors. Yes, also address your physiology. Work on both levels and you'll see better results. I also want to acknowledge that for some people, anxiety is related to trauma. If you've experienced traumatic events, particularly in childhood, your nervous system might be stuck in a chronic state of hypervigilance and threat detection. This goes beyond normal anxiety and requires specialized treatment. Trauma therapy approaches like EMDR, somatic experiencing, trauma-focused CBT can be incredibly helpful for addressing the root causes and helping your nervous system reset. If you suspect trauma might be a factor in your anxiety, I encourage you to seek out a therapist who specializes in trauma treatment. Similarly, if your anxiety is part of a larger mental health condition like PTSD, OCD, panic disorder, or generalized anxiety disorder, you'll benefit from working with a mental health professional who can provide a proper diagnosis and comprehensive treatment plan. The strategies I've discussed are helpful, but they might not be sufficient on their own for more severe conditions. There's no shame in needing professional help. In fact, seeking help is a sign of strength and self-awareness. Also, talk briefly about what not to do, because there are common coping strategies that actually make things worse. Don't use alcohol to help you sleep. It might make you drowsy initially, but it disrupts your sleep architecture and makes sleep less restorative. You'll wake up feeling worse, and you're at risk of developing a dependence on alcohol for sleep, which is a whole other problem. Don't use your phone in bed. The blue light suppresses melatonin. The content is stimulating and distracting, and you're training your brain that the bed is a place for activity rather than sleep. Don't lie in bed for hours trying to force yourself to sleep. If you can't sleep after 30 minutes, get up and do something calm, then try again later. Forcing it just creates anxiety around sleep itself. Don't beat yourself up for having anxiety. Criticism and shame just add more negative emotion on top of what you're already feeling. Practice self compassion instead. Talk to yourself the way you would talk to a good friend who was struggling. You would be kind and understanding, right? Extend that same kindness to yourself. Don't compare yourself to other people who seem to fall asleep easily and never worry about anything. Everyone has their struggles, and anxiety is your particular challenge. That's okay. You're working on it, and that's what matters. Expect perfection. Some nights will be better than others. You might have a week where you sleep great, and then a night where anxiety keeps you up. That doesn't mean you failed or that nothing is working. It just means you're human and life has ups and downs. Overall trend is what matters, not any individual night. As long as you're generally moving in the right direction, with more good nights than bad nights, you're doing well. One more thing I want to address is the role of relationships and social connection in managing anxiety. Humans are social creatures. We're wired for connection. When we feel isolated and alone, our anxiety increases. When we feel supported and connected, our anxiety decreases. This is partly physiological. Social connection literally calms your nervous system. It's also psychological. When you share your struggles with someone who listens and validates you, it reduces the burden. You're not carrying everything alone anymore. If you're dealing with nighttime anxiety, don't isolate yourself. Talk to people you trust about what you're going through. You don't have to go into every detail if that feels too vulnerable, but let people know you're struggling with sleep and anxiety. You might be surprised by how many people can relate. Anxiety and insomnia are incredibly common. Chances are the people in your life have dealt with similar issues. And even if they haven't, most people want to be supportive when someone they care about is struggling. Consider joining a support group, either in person or online, for people dealing with anxiety or insomnia. Hearing other people's experiences and strategies can be validating and helpful. You'll realize you're not alone, and you might learn new coping techniques. There's also something powerful about sharing your own story and hearing that it resonates with others. It creates connection and reduces shame. If you have a partner, talk to them about your nighttime anxiety and how it affects your sleep. Let them know what they can do to support you. Maybe that's giving you space to do your bedtime routine without interruption. Maybe it's being understanding when you need to get up and move around because you can't sleep. Maybe it's doing breathing exercises or meditation with you. Having someone in your corner who understands what you're dealing with makes a big difference. At the same time, be careful not to rely too heavily on others for reassurance. It's natural to want reassurance when you're anxious. You want someone to tell you everything is going to be okay. But constantly seeking reassurance can actually make anxiety worse over time. You become dependent on external validation to feel okay, which means you never develop your own internal sense of security. This is a tricky balance. It's good to have support, but you also need to build your own capacity to manage anxiety. Work on both. Cultivate supportive relationships and work on internal regulation skills. I've covered a lot of information here, and I know it might feel overwhelming. So let me try to distill it down to the most important actionable steps. First, understand that nighttime anxiety is not your fault. It's the result of biological mechanisms that are working against you. This understanding alone can reduce some of the shame and frustration you might feel. Second, relying exclusively on distraction during the day. Carve out time to actually feel and process your anxiety. Go for walks, meditate, use breathing techniques. Build your capacity to sit with uncomfortable feelings. Third, practice slow breathing with long exhales. This directly calms your nervous system and is a tool you can use anytime, including at night when you can't sleep. Fourth, address rumination. Break the cycle of repetitive negative thinking using thought-stopping, scheduled worry time, journaling, or cognitive diffusion. Fifth, honor your sleep window. Pay attention to when you naturally start to feel tired in the evening and go to bed then, even if you don't feel ready. Stay up until you're exhausted. Sixth, create good sleep conditions. Dim lights in the evening, cool room, comfortable bed, no screens in bed. Seventh, increase pro-sleep signals during the day. Exercise, be productive, eat well, get natural light. Give your brain and body the signals that you've had a full day and earned your rest. Eighth, consider working with a therapist or counselor who can help you develop better coping strategies for anxiety. CBT, ACT, mindfulness-based approaches, these can all be very effective. Ninth, talk to a doctor if you think you might have an underlying condition contributing to your anxiety or insomnia. Get evaluated and discuss whether medication might be appropriate. 10th, be patient and kind with yourself. Change takes time. Small improvements and don't expect perfection. These steps are not a quick fix. They require consistent effort over time. They work. I've seen them work for countless people. And the beautiful thing is, as your nighttime anxiety improves and you start sleeping better, everything else gets easier. Your daytime anxiety decreases. Your mood improves. Your focus and concentration improve. Your physical health improves. You have more energy and resilience. Good sleep is truly foundational for overall well-being. I want to end by saying this. If you're struggling with nighttime anxiety, you're not alone. Millions of people deal with this. It's a real problem with real causes. And there are real solutions. You don't have to just accept sleepless nights and constant worry as your reality. You can change things. It takes understanding, effort, time, but it's absolutely possible. You deserve to sleep well. You deserve to feel calm and rested. You deserve to not be ruled by anxiety. Take what you've learned here and start implementing it. Start small if you need to. Maybe you just commit to going for one walk this week where you don't bring your phone and you let yourself feel whatever comes up. Maybe you spend 5 minutes doing breathing exercises tonight before bed. Whatever feels manageable, start there. And then build on it. As you work on this, pay attention to what helps and what doesn't. Everyone is a little different, and you might find that certain strategies work better for you than others. That's fine. The goal is to develop your own personalized toolkit of strategies that help you manage anxiety and sleep better. Expert on your own experience. Use what I've shared as a starting point, but adapt it to what works for you. And remember, biological mechanisms that cause nighttime anxiety exist for a reason. Your amygdala becomes more active at night to process emotions through dreams and to maintain threat detection while you sleep. Adaptive functions that have kept humans alive for millennia. The problem isn't that these mechanisms exist, it's that they can become dysregulated, especially in the context of modern life with its chronic stress and constant stimulation. Just as these systems can become dysregulated, they can also be regulated again. You're not broken. Your brain is doing what it thinks it needs to do to keep you safe. Your job is to help it learn that it doesn't need to be on high alert all the time, that it's safe to calm down. Anxiety doesn't need to run the show. This is a journey, not a destination. There will be setbacks and challenges along the way. There will be nights when you do everything right and still can't sleep. There will be times when your anxiety spikes for no apparent reason. That's all part of the process. What matters is the overall trajectory, the general trend over time. Are you sleeping better overall than you were a month ago? Are you managing anxiety better? Are you feeling more in control? These are the questions to ask yourself, not whether any individual night was perfect. And as you make progress, be sure to acknowledge it. It's easy to focus on what's still wrong and overlook how far you've come. But celebrating progress, even small progress, is important. It reinforces that your efforts are paying off and motivates you to keep going. Maybe you keep a sleep journal where you track not just how well you slept, but what strategies you used and how you felt. Over time, you'll be able to look back and see patterns and improvements that might not be obvious day to day. I also encourage you to think about anxiety differently. Instead of seeing it as an enemy to be defeated, what if you saw it as information? Anxiety is your brain trying to tell you something. Sometimes it's a legitimate warning about a real problem that needs attention. Sometimes it's a false alarm based on past experiences or distorted thinking. But either way, it's communication. When you feel anxious, instead of immediately trying to make it go away, pause and ask yourself what the anxiety is about. Is there actually a problem I need to address? Is there something I'm afraid of? What is my brain trying to protect me from? This inquiry can be revealing. You might discover that there are legitimate issues in your life that need attention. Maybe you're in a job that's wrong for you. Maybe you're in a relationship that's not healthy. Maybe you're not living in accordance with your values. Anxiety can be a signal that something needs to change. Obviously, all anxiety is this straightforward. Much anxiety is irrational and not connected to anything that actually needs to change. But it's worth asking the question. Addressing the underlying life issues that are contributing to anxiety is just as important as learning better coping strategies. At the same time, be careful not to get too caught up in analyzing your anxiety. There's a balance between useful reflection and counterproductive rumination. If you find yourself endlessly trying to figure out why you're anxious, what it means, where it came from, you've probably crossed into rumination territory. Sometimes you just need to accept that you feel anxious. Use your coping strategies to manage it and move on with your day. You don't always need to understand everything. I hope this has been helpful in giving you a comprehensive understanding of why nighttime anxiety happens and what you can do about it. Key insights are that nighttime anxiety has specific biological causes related to cortisol, the amygdala, the frontal lobe, melatonin, and the default mode network. Distraction as a coping strategy during the day actually makes nighttime anxiety worse by conditioning your brain to rely on external stimuli for emotional regulation. You need to develop internal regulation skills through practices like sitting with anxiety, breathing techniques, meditation, and working with thoughts through therapy or self-reflection. You need to honor your sleep window and create good sleep conditions. You need to address both the psychological and physiological components of anxiety with a comprehensive approach. This is all based on neuroscience, clinical experience, and solid research. These aren't just theories or guesses. This is how the brain actually works, and these strategies are proven to help. So trust the process. Put in the effort. Be patient with yourself, and know that better sleep and less anxiety are absolutely achievable. You can do this. Your brain is capable of change. Your nervous system can learn to regulate differently. Your sleep can improve. It's not easy, but it's possible, and you're worth the effort. Take care of yourself, be kind to yourself, and keep working at it. Better nights are ahead.